This video is meant to be an introduction to diabetes, so it kind of starts at square one. If you've recently been diagnosed with diabetes, you would have met one of 4 criteria. You could have had a fasting blood sugar of 126 or more. You could have had a 2-hour glucose of 200 or more after a 2-hour glucose tolerance test. Or you could have had a random blood sugar, meaning a blood sugar taken at any time of day under any circumstance of 200 or more, along with symptoms of diabetes, which would include feeling really thirsty, having to urinate a lot during the day, or waking up in the middle of the night to pee, or feeling really hungry. Or lastly, you could have had an A1C of 6.5% or higher. So these criteria are used to diagnose diabetes of any type, be it type 1, type 2, or any of the other subtypes of diabetes. But the pathophysiology of type 1 and type 2 diabetes are a little bit different. And a lot of my patients ask me, am I type 1 or type 2? And it's important because we do treat them a little bit differently. But type 1 diabetes is when you have antibodies that are directed against the cells in the pancreas that produce insulin. And so over time, it causes an inability of the pancreas to produce sufficient amount of insulin to bring the blood sugars into normal range. In type 2 diabetes, it starts out as a problem of insulin resistance, where your tissues need more insulin than usual to bring the blood sugars into a normal range. Now, with type 2, initially the insulin levels are quite high, and the body's able to sustain normal blood sugars, but eventually the pancreas kind of can't keep up and kind of burns out, and so that's when you'll see the blood sugars start to rise and getting above normal. So, why do we worry about diabetes so much, and kind of what's the big deal about all of this? What we worry about the most is end organ dysfunction caused by high blood sugars over time. And what I'm talking about with that particularly is that if sugars are sustained higher than normal for a longer period of time, then you can have damage to the kidneys, leading to chronic kidney disease and dialysis, damage to the eyes, or the back of the eye, the part called the retina, which can cause problems with your vision and ultimately, in worst cases, blindness. Neuropathy, which causes a sensation of numbness or tingling in your fingers or toes to start with, or gastroparesis, which is slowing of the emptying of your stomach, the contents of your stomach when you eat. And then last and most important, because it's the #1 threat to the lives of diabetics, is atherosclerosis and heart disease or stroke. So even if you and I don't talk about it explicitly each time, I'm going to be looking at 3 parameters, which I call the ABCs of diabetes, and that's parameters that we're going to be looking at to reduce your risk of progression to or progression of coronary artery disease. A being your A1C, and we're going to target an A1C of usually around 7% or lower, but we'll talk a little bit more about that in a minute. 2, B, your blood pressure, and so for that we want to keep you at a blood pressure in the 130s over 80s or less. And then 3, C, being your cholesterol, and the primary target of your cholesterol being your LDL cholesterol. We'll be measuring that at least once a year. We'll be looking also at your 10-year risk for having a heart attack, and I'll calculate that for you in your visit so that we have a sense of where we're at now and how we can improve your chances of protecting yourself from heart attacks and strokes and kidney disease and things like that. As far as blood glucose targets, a lot of people want to know, where they should be. We talked a little bit about the A1C, but on a day-to-day basis, your actual blood sugars are going to be more important to you because that's what you're going to be looking at home. A fasting blood sugar, we want that to be between 80 and 130, and any preprandial, meaning when I say preprandial, I mean before meals, so before lunch or before dinner. Ideally, those would be less than 140. If you're checking after you've eaten, then the numbers are a little bit different, and we want your peak postprandial blood sugar to be less than 180, and that means that it could be between 1 and 2 hours after your meal, the highest blood sugar being 180 or less. So if you have a glucometer already, please be checking your blood sugars. Um, you know, if you can check at least once a day, if you're not on any therapy, and bring those blood sugars to your visit with me along with your glucometer, because I do look at those every single time. And then mark down if it's a fasting blood sugar before lunch, before dinner, or at bedtime. Or if you happen to check it, you know, after a meal, how long after a meal, because those are very useful in kind of figuring out what your particular blood sugar trends are, and ways that we can help you get those under better control. As far as therapy, the mainstay of treatment, cornerstone of treatment by far and away, definitely is lifestyle. This is a good thing because it's you know, gives, I think, a lot of power to the patient, power to you. Lifestyle, you know, really does make a difference. Weight loss if you need to lose weight, and the good thing is that, you know, sometimes people think, well, I need to get down to ideal body weight, or I need to lose so much weight, you know, I can't do it, why should I try? But really, even 5% weight loss will really make a difference and can lower your A1C as much as 1 to 2%. So, you know, even a little bit goes a long way when it comes to weight loss. And the best way to lose weight, or the most efficacious way to lose weight, is going to be through diet, and creating a calorie restriction. For most women, that's going to be a diet of approximately a max of 1,200 to 1,500 calories per day. And for men, usually it's going to amount to about 1,500 to 1,800 calories per day in order to produce some weight loss. A lot of my patients ask me about carbohydrates, and I think that this is really important for you to just kind of be cognizant of carbohydrates, because they are the macronutrient that's really going to increase your blood sugars the most, and they have the most impact on how your blood sugars run after you eat. And so carbohydrates are going to be foods that are like breads and pastas, dairies, like because of the lactose in the milk. So, you know, milk, ice cream, that kind of thing. Fruits and starchy vegetables. So any foods in those 4 categories are going to be considered carbohydrates, or they're going to contain carbohydrates. So I'd like you to try to start looking at labels if you're not already. You'll get one of these. This is my handout on carbohydrate counting. And what you'll want to do is take a look at the serving size and the total carbohydrates on the foods that you're eating, just to kind of get a sense of how much carbohydrates you're eating. And so, for example, this label is a label for milk. And it says total carbohydrates 12 grams. The serving size is 1 cup. So important thing is going to be to understand that the amount of carbohydrates that's listed on any label is just an arbitrary amount. It's the amount that's contained in that serving size. But maybe you don't drink 1 cup of milk, maybe you drink 2, and then you would have had 24 grams of carbs instead of 12. Or maybe you only had half a cup, and so then you would have had only 6 grams of carbs instead of 12. So you just need to make sure that you're paying attention to the serving size and multiplying how much you had by the total carbs there. So that's that. As far as how many, you know, a lot of patients ask me, well, how many carbs am I allowed to eat? There's no specific diet that's recommended for patients who have diabetes. If you want to do low carb, that's okay. The only thing I would caution against is a very high carb diet. General rule of thumb, I think that 45 grams of carbs per meal for females, and 45 to maybe up to 60 grams of carbs per meal for men or less is a reasonable amount of carbohydrates to stick to with the meals. Sometimes my patients think I'm saying you have to eat at least that much, and that's the max. I don't want you eating over that, and that'll help because it's kind of a moderate amount of carbohydrates. It'll help to kind of keep those blood sugars steady throughout the day too. The second part of lifestyle, aside from diet and weight loss, is physical activity. So the recommendation here is to try to shoot for or work up to total of 150 minutes per week of moderate intensity aerobic exercise, or 75 minutes per week of high intensity aerobic exercise. And that can be divvied up any way that you want, as long as you're having at least 10 minutes of cardiovascular bouts of 10 minutes or more of cardiovascular activity. You can do, for example, 30 minutes 5 days a week, or any way you'd like to slice and dice it. The only thing I would caution against is having any longer than 2 consecutive days without exercise. And then also adding on to that, 2 to 3 days per week of resistance training really helps too. Now, not everybody is ready to start with that amount of exercise. If you're somebody who hasn't exercised in a long time, please do not start up with that amount. Just start with walking 10 minutes a day, and listen to your body. Start slow, increase gradually. If you have any shortness of breath or chest pain at all, stop and don't do any more, and listen to your body. Last, we'll talk a lot about medications whenever you come into the visit, just to kind of give you an idea of what to expect if you already know what your A1C is. If you're at 9% or more, most likely I'm going to be recommending starting 2 different agents. If you're at 10% or more on your A1C, we're probably going to be starting with the combination injectable therapy, but I don't want that to scare you at all. Injectables or multiple medications, they are not your enemy. They are actually there to help you, and it doesn't mean that you're on them forever. Sometimes we just need to do a little bit more to begin with to get your blood sugars under good control, and as you keep up with lifestyle and things like that, then the blood sugars come down, then we're able to kind of back off a little bit. So don't be scared about the medications. We are here to help you through that, to teach you how to use them, and get your health into a good place. So I hope this helped. And that's it. So good luck, and don't forget to bring your blood sugars with you to your visit. All right. Thank you so much. Bye.